This video is going to be explaining what MSK is and explain a little bit about how it is not a benign condition. So MSK is medullary sponge kidney. It's also known as Cacchi-Ricci disease, but mainly we just call it MSK. That's a little simpler to say. Cacchi-Ricci is kind of an odd name. But it is a congenital disorder of the kidneys. And so basically that means that it is present from birth. However, symptoms do not always present until late adolescence and even adulthood in most cases. So what MSK is the tubules in the kidneys did not properly form in utero, which basically means when your mom was pregnant with you, your kidneys did not fully form. And so it results in something called cystic dilations of the collecting tubes. Fancy term for your kidneys don't quite do like they're supposed to do. And so on imaging scans, this cystic dilation shows up as a sponge-like appearance. And so it literally looks like a sponge. And 70% of cases are bilateral, which means the MSK is present in both kidneys. Not always, but the research I have found shows that most cases are bilateral, both kidneys. So patients with MSK are at increased risk for kidney stones, urinary tract infections, and they typically pass way more stones per year than other stone formers. MSK has been recorded in research that it's a benign condition, which basically means it's kind of incidental, that it doesn't really cause any symptoms. But the more that I'm researching and the more that urology is kind of catching up, we're seeing that it is not the benign condition like it's been portrayed. Most MSK patients report chronic kidney pain, renal colic, frequent stones, and recurrent infections. But it's interesting because MSK is a unique disease because for the most part, patients are not candidates for transplant. Only 10% of patients suffer with renal failure and require dialysis. So it's a very unique disease, which is not to say that it can't cause the need for dialysis, but as a rule, the main markers of the disease are the chronic stones, the renal colic, and the increased risk for urinary tract infections, frequent UTIs. If you do a Google search for MSK, you're going to find a lot of information, like I said, that says it's a benign condition, which is one reason that I'm working on research and trying to present things like the MSK survey that absolutely show that that's not always the case. The outdated dissonance in the medical field is really a nightmare for patients with this condition because they're taught that there's nothing really special about it, and which might inhibit appropriate care for recurrent stones and the flank pain, specifically in emergent settings. If you go to an ER emergency room and you say, oh, I have MSK, and you present with a kidney stone, most of the time they've not heard of the condition. Which is, again, one reason why I did publish the book, because I wanted to make sure that there was documentation that was, sourced and accurate, so that way people would not have to struggle with the absolute ignorance and dissonance. So if you want more information on managed medullary sponge kidney, you can find my book on Amazon. I will do a screen share really quick so that you can see what the book looks like. And hopefully it will benefit someone. This is what the book looks like on Amazon. It's called Managed Medullary Sponge Kidney by me, Winslow E. Dixon. And I'm sharing this, like I said, because I have seen the dissonance and I have seen the ignorance in medical professionals. And I don't want that to happen to anyone else, because when you're in severe pain, when you have chronic kidney stones, it's a very daunting experience, and unmanaged chronic pain is very difficult on your endocrine system. Your adrenals do not like chronic pain that's unmanaged. And so my hope is that this book will help educate, not only medical professionals, but also help validate MSK patients that they're not alone and that they're not crazy and that there are actual options. So that's on Amazon. And I also run a holistic clinic, Hope Healing Happy Clinic. If you need any information or support with that, I do see patients remotely. I'm not an MD, I'm a naturopathic physician, but we do have the chronic kidney stone management program, and I have MSK myself, so I have kind of had to learn to live with it. So again, I thank you for watching, and I wish you hope, healing, and happiness.